welcome to the Purposeful Lab, production of Franciscan University. On the show, we look at topics related to meaning and purpose in our lives. And we use both the wisdom of the church as well as the best of all the different academic disciplines to get at these key questions that look at why we're here and what the purpose of our lives are. And this season, we've been looking at the nature of men and women. And so we've had a number of speakers and guests come on. And today we're going to have Dr. Andrew Sodergren as our guest, and he's a clinical psychologist. Andrew, welcome to the program.
Thanks, Dan. I'm so glad to be here with you.
Great. Well, just a little bit about background about Dr. Sodergren. So he has both a master's and PhD in clinical psychology from Divine Mercy University. And then in 2011, he founded the Woods Institute. We'll have him talk a little bit about that. He's a member of the Catholic Psychological Association. And he's author of a chapter in a book. The book is called Sexual Identity, The Harmony of Philosophy, Science, and Revelation, published by St. Paul Center. And his chapter was Psychology of the Sexual Difference, which is very apropos for our topic today. But before we get into that, Andrew, it'd be great to hear a little bit about the Rural Woods Institute and what you founded that for. I know it's got provides psychological services that are in line with the best of psychological practices and the wisdom of the church, but it also provides and develops curriculum related to John Paul II's theology of the body. So maybe give us a little background of why and how you started that and where you're at right now with that.
Sure. Yeah, so Rural Woods Institute is a theology of the body apostolate based here in Cincinnati. And we really have two primary functions, if you will. One is theology of the body education, and the other is psychological services informed by a Catholic view of the human person. And just to be clear, my role is primarily in the psychological services branch of our ministry. So the theology of the body education part actually preceded me by a couple of years, but was one of the things that attracted me to this ministry because I do have a background in theology as well from the John Paul II Institute. And so his thought and theology of the body in particular was very, very formative for me, both in my personal life and also in my professional life as a psychologist, because John Paul II was eminently concerned about the nature of the human person and would always bring questions he was wrestling with back to these basic questions of human nature and what does it mean to be a human being created in God's image and so forth. So I saw his thought and his work as central to kind of my personal mission as a Catholic psychologist. And so when the founders of Rural Woods and I connected, it just seemed like a perfect fit. So I joined the ministry pretty early on, and from that time, it's been interesting to see its development. So on the psychological services side, we're still primarily an in-person outreach here in Cincinnati and the greater Southwest Ohio region. We have 5 Catholic mental health professionals now, including myself. And as I mentioned, we try to do our work of, walking with people, bringing healing to people who are suffering, but from the standpoint of our Catholic faith. That doesn't mean that we're talking about issues of faith all the time in our sessions, but it means that we try to look at the person and think about health and what a good life is and disorder through the lens of a Catholic anthropology. And on the other branch of the ministry, the theology body education side, that aspect has really evolved in a very exciting way over the years. We moved from exclusively in-person local ministry to a national and even international ministry because we developed the world's first kindergarten through 12th grade theology of the body curriculum. It's a supplemental curriculum that can be integrated into any Catholic school environment or homeschool situation, or even parish religious preparation programs. So it's a supplemental curriculum that's very versatile, and it's age appropriate from kindergarten all the way through 12th grade. And so developing that curriculum has really put us in a position to focus on Catholic schools, Catholic educators, and catechists, and trying to help them and accompany them so that they can bring this wonderful vision of the human person to kids of all ages. And so we also provide ongoing education and support for educators and catechists through our studio and through our other resources that we're continually developing. And so that's the theology of the body education side. And as I already described, we have our psychological services side, which is growing more organically step by step here in this region.
That's great. I imagine if people are interested in particularly that curriculum, they can go to the Rural Woods website and find links there on how to access it.
Yes, absolutely. Yeah, ruralwoods.org is easiest way to find it for sure.
Wonderful. So, as a psychologist, clinical psychologist, what is it, as a Catholic, how is it that what's your framework for approaching your patients? You sort of alluded to it there, but maybe you could sort of flush that out that makes your, the services that the way you approach a patient different than maybe a secular psychologist.
Yeah, it's a great question, Dan. So, a lot of times when we think about faith integrated care, faith integrated therapy, what people often think about is, asking the patient about their faith life, talking about matters of faith, maybe praying in session, doing things like that. And we certainly do those things, but to me, that's not the heart. That doesn't really get at the heart of what we're trying to do, because what we're trying to do is to integrate a Catholic vision of the person into the entire process. And so for me, that means, first and foremost, it has to penetrate the heart and mind of the therapist, and it has to shape the way that we look at our patients, the way that we engage with them, the way we think about the whole purpose of therapy, the nature of health and disease, and all of those things, the purpose of human life. Right. So all of that needs to be sort of operative within the therapist, and then it can inform the work that we do. Whether we're working with a Catholic patient or an atheist or a person of a different faith tradition, it needs to inform us as therapists, because this is what we believe to be true about our common humanity. And so what does that look like in practice? Well, one of the ways that I think for me that it's very, very helpful, very orienting, is to think about how we were made, to paraphrase John Paul II, out of love and for love. So this idea of a vocation to love has something really fundamental to do with our identity as persons and our ultimate calling. And so that's one of the central things that I look at with people when I'm doing my clinical work, is their capacity to give and to receive love, and how has that been blocked or distorted in their life experience, right? Because it's something that we have to grow into, and our human experiences are, in relationship, especially our families, but any kind of significant relationship is very much part of that, very formative for our capacity for love. And so a lot of the work that I do really has to do, really focuses in that area quite a bit. And we certainly work with all kinds of different things, but a lot of the struggles that people come in with can ultimately be traced back to those kinds of difficulties.
Yeah, no, it seems like those would be at the root of a lot of things: marital issues and parent issues and so forth. That's a wonderful framework to get at a lot of sort of psychological issues. So, one of the issues, we were talking on the show today, the topic this season about the nature of men and women, and I know that you have, over the last few years, have been speaking a lot and been drawn into talking about the psychology of sort of gender dysphoria in children that are struggling with their determining their gender. So you've practiced, sort of widely. This isn't, you're not like a specialist in this area, but this is something that's sort of come up, right?
Right.
Into your practice. So, if you could just maybe give us a little bit of background of how you've been brought
Yeah.
into talking about this really, timely and pertinent issue.
Yeah, I'd love to. It's an interesting story, and I'll give you the short version of it. But it's interesting because it has very much the signs of providence kind of woven through it, because this was not ever an issue that I really pursued or sought to gain any kind of expertise or notoriety in. It just sort of happened that way. And the preparation for that really goes back 20 years, actually a little more than that, to when I was a graduate student. And I happened, again, through divine providence, to have some very good teachers who were very attentive to these issues of research on sex differences, for instance, and in theology, understanding the theology of the sexual difference and how we talk about that in Catholic anthropology and account for the difference between man and woman, and what all that means. So I had really good preparation theologically, philosophically, and in terms of the social sciences, well before this whole current phenomenon of transgenderism really blew up. Right. Yeah. And so I had that kind of background, and then when this became more the topic of the day, I felt prepared to speak into it, and I did so tentatively at first. It wasn't something, again, that I sought after, but once you kind of put yourself out there once, you get another ask, and then another ask, and then another ask.
Especially on a topic like this, with a lot of people don't want to touch or don't feel.
Yes, yeah, yes, that's right. Sure. I have many colleagues who I think could do a wonderful job, but they're very wary about going into this, because our profession, and by our profession I mean the broader mental health field, psychology, social work, counseling, you name it, is so aligned with the gender ideology worldview that to counter that is a big professional risk in a lot of people's minds. And so many people just don't want to go there, and I completely understand that. But this thing kind of got rolling, and I just kind of kept going with it. And the most interesting little turn of event was connecting with John Finley, who's the editor of the sexual identity book that you mentioned. He was teaching at the seminary in St. Louis at the time, and was looking for some content experts to come in and speak about this issue to his seminarians. And he literally just was Googling online, Catholic psychologist gender. And he happened to find me somewhat randomly, and it had to do with my connection through the John Paul II Institute and a course I was teaching there as an adjunct. And so we connected. He had me come out to speak to his course, and then that led to the book project, and that led to more speaking engagements and so forth and so on.
Yeah, it's interesting. That's how I got connected with you, doing work with Catholic seminarians, these topics, and asking colleagues here at Franciscan, who's a psychologist that could speak into this area, and that's, your name came up. So it's like you like you said, you put your toe into this water. That's right. You keep getting brought in. So. So let's talk a little bit about gender dysphoria and that term, sure, because it's interesting. That's a relatively new diagnosis. It used to be called something different. So maybe you could just speak to the gender dysphoria as a psychological diagnosis, where it came from, and sure, in a sense, the changes over time and sort of the numbers of people that are identified with that.
Yeah, the history of this diagnosis is interesting in its own right, and then there are these recent phenomena that are also quite perplexing. So, what we now know or refer to as gender dysphoria went by some previous names. Prior to gender dysphoria, it was gender identity disorder, and even prior to that, it was transsexualism. And the change from transsexualism to gender identity disorder, I think, was an attempt to mostly try to come up with a term that this was less stigmatizing. The cultural mores shift to a certain degree, and it's not always bad. Okay, we want to maybe have a little more sensitivity how we refer to certain things, but the shift from gender identity disorder to gender dysphoria was more than just that. There's an ideological push that led to the terminology that we use now. Let me explain what I mean by that. So with gender identity disorder, it was pretty clear that the hallmark of this disorder is a disconnect between my subjective view of self and the objective reality of my body. Okay, and so if there's a disconnect between my subjective perception and objective reality, that was considered a sign of psychological disorder, as it still is in most respects. But what's happened is there's a large number of people in our field that want to uphold the idea that you can have a discordant gender identity, a subjective view that differs from the body. I might think that I'm female. I might mentally be female in some sense or think of myself that way, even though I have a male body. And they want to say that that's not unhealthy. That's not a disorder. And so with gender dysphoria, there's a real shift to putting emphasis not on that disconnect, but on any distress or impairment that results from the disconnect. So trying to depathologize the idea of having a gender identity different from the body. And that's why we have gender dysphoria now. The emphasis is on the dysphoria, not on the gender identity itself.
So it's making that more normal. Like, hey, it's perfectly natural that you have that, and now you have some psychological issues associated with this condition or this disconnect, right? And so they're coming for counseling to deal with that, to try to say this is a normal thing. Let's try to address it so you can live with this disconnect.
That's right.
Yeah.
Yeah, and it's very similar to what we saw happen with homosexuality a few decades ago, right? Because homosexuality was once listed in our diagnostic manual as a mental disorder as well, and ultimately it was normalized and taken out. And so the question arises: why not just take this out altogether as well? And the reason for that, the reason that it hasn't been taken out, is that you have to have a diagnostic code in order for the transitioning procedures like hormones and surgeries, in order for them to have insurance coverage or to get reimbursed by government programs or what have you. So you have to have a diagnostic code to put down. But the idea, ideologically driven idea, is to depathologize the diagnosis as much as possible, right? To move it away from the trans identity. But we have to have a code if the services are going to get paid for.
Yeah. And so in the last 10 years, you see, there's been a spike in people diagnosed with this, and there's also been a difference in terms of the sexes that present with this condition. So maybe just sort of talk about how it's changed over those 10 years, and maybe what your feeling is about why that has happened.
Absolutely. Yeah, so there's some big questions in there. So first, let's just talk about how the landscape has changed. Traditionally, this was a predominantly male condition. Now, females would sometimes experience gender dysphoria or gender identity disorder as well, but the sex ratio was about 3 to 5 times males over females in terms of rate of diagnosis. And the prototypical case in the clinical literature was a grade school age boy. And so, it would look something like this. You have a boy somewhere between, say, kindergarten and 4th grade who is dissatisfied being a boy, likes to play with the girls, identify with girl things, wants to wear girl clothes, maybe even thinks that he's a girl or says he wishes to be a girl. And it seems to persist enough that it's just not kind of going away. And so the parents might bring this boy to a clinic of some kind or a therapist of some kind. And the vast majority of those cases would remit. That was the typical phenomenon. What's happened in the last 15 years or so is a huge increase in the number of adolescents reporting with gender dysphoria without any prior history of gender dysphoria. And if you look at this cohort of adolescents showing up at gender clinics, the sex ratio has flipped. And so now it's something like 2 or maybe even 3 times as many females compared to males, whereas before it was the other way around. And researchers really have no way of accounting for this. It was completely unexpected. There's no precedent for this kind of thing, that an established, diagnosis the sex ratio would suddenly flip, right? And so even just the most secular researchers looking at this have to begin to consider cultural influences and things of that nature to try to explain what is going on here. And that gets into the second part of your question, which is very, very complex and necessarily speculative, because we really don't have all of the data yet. This is still very new. But I think there are several things going on, and the research that we do have, when you start looking into the cases of these adolescents with gender dysphoria, especially these girls, the females with gender dysphoria, many of them have very complicated and difficult histories of psychosocial problems. So we see high rates of mood disorders like depression and anxiety. We see lots of different kinds of social problems, and not related to gender at all, but just difficulty fitting in. Maybe experiences of bullying, experiences of exclusion, just having a hard time making friends. Other types of psychological problems as well, like ADHD and autism, show up in these young people. And so there's this evidence emerging that these are psychologically troubled youngsters who are looking for an answer, looking for something to explain their distress and why they've had all these difficulties. And through social media, through the internet, through cultural influences, coming to this idea that maybe it's because I'm trans. And then they try on this label, first maybe privately. They watch testimonies, they read and, digest all sorts of media online. They experiment with it in their head. Maybe they try it out with some peers. And parents are usually the last ones to find out. Yeah. Right? And so this new identity begins to kind of reinforce itself in a way, because it gives them the hope that maybe this is not only the explanation for why I've had all these difficulties, but it's my path to a better life, right? So they begin to fantasize, well, maybe if I transition, then maybe I'll feel more confident and I'll feel better about my body and I'll be able to fit in better, and all of these things that they anticipate will come from it. And to a certain extent, some of that is true if you just think about how, in certain environments, young people, especially today, are sort of trained almost to respond when someone, quote unquote, comes out, right? It's something to be celebrated, right? So exactly. So you're welcomed into this community, you're embraced, right? Now you have a place, and you have all these connections, and you have now a purpose because you have this like cause that you can champion, right? So there's all sorts of like psychological reinforcers available when someone starts to go down that path. And it just kind of builds on itself, right? And then there's the poor parents back here, like I said, the last ones to find out. And if they have any difficulties with this, they're in a really disempowered position, because at that point, the young person has already latched onto this label that's already been socially reinforced to some degree, and they're oftentimes working against people in my profession, doctors, counselors, educators who might be saying to them, you need to embrace your child's new identity, and maybe even, using the scare tactic of if you don't, your child's going to end up committing suicide.
Right. Yeah. And all of this seems to come out, like the age that people start to present with this it's a very difficult age, right? These kids are like normally, even a healthy, person going through puberty, young girls, young boys are not comfortable in their body yet. They feel awkward. So it's a very difficult time. And then like you said, you add these other psychological factors.
Absolutely.
And then I believe there's certain family structure issues that are more likely to be found in
That's right.
gender dysphoria. So you compound this very difficult time of life, right?
Right. So adolescence, it's a difficult time of life, and anybody in that time frame, the teen years, and even into young adulthood, they're searching for these big answers to big questions like, who am I? Where do I belong? What's my purpose? So that's all operative in the background. I mean, that's normative. Right. But then when you add these other difficulties on top of it of, I haven't fit in, I don't feel good about my body's changing, I'm worried and scared about what it means to become a sexual being, a sexual person, especially for young women. If you think about the way that womanhood is portrayed in our culture, and you think about things like the exposure to pornography, it's no wonder that a lot of young women, adolescent girls are uninterested in becoming a woman in this society and would feel much safer if they were men.
They don't want to be objectified in the way that they see with pornography.
Exactly.
Right. Yeah, that makes sense.
Yeah. I've heard that on both sides, actually. What I mean is the girls not wanting to become a woman because that means I have to be objectified and mistreated by men. And on the other side, I've heard young men say that they don't, because of what they learned through pornography, to be a man means to be someone who uses and abuses women. Okay. And so I don't want to be that. I don't want to be, if that's what it means to be a man, I don't want to be a man.
Yeah, that's interesting, the connection there that exists from this basically over-sexualization at an early age that comes with pornography and other things. So what is the standard, gender-affirming care? You always hear that term. And if you could just sort of take us through sort of what the standard has been and why that, maybe after you go through that, what are the issues with that from your perspective?
Sure. Yeah. So historically, before we got to our current situation, the treatment of choice for gender dysphoria was psychotherapy. And with children, like I said, the typical case was the grade school age boy. That would often look like some type of play therapy with the child and parent coaching with the parents, or some variations of that. Right? There's a few different models that were used in the clinical literature, and they were pretty helpful, and they were pretty standard treatment approach. There was nothing sort of coercive about it, nothing strange or unusual about it. It's just good quality psychotherapy, and that was the treatment of choice. Late 90s, early 2000s, some Dutch researchers began to propose the idea of what if, instead of doing that, we offer puberty suppression. You can administer medications to suppress the natural process of puberty. And that had been around for a while. There's a condition called precocious puberty, which is a real medical problem when, let's say, you have a 6, 7, 8-year-old who's already starting to go through puberty. It's at the wrong time. So medication had been developed to treat that. They were saying, well, what if we offered that to young people with gender dysphoria so that they can delay puberty and have more time to kind of sort this out. And then also it gives them more of a sort of a blank slate, a clean slate, if you will, so that if they do want to transition, they'll look more like the opposite sex because they haven't gone through puberty yet. And so the Dutch protocol was developed, and that's the term that I really prefer to use. We often hear the term gender affirming or gender affirmative care. I see that as a euphemism because to me there's really nothing affirming about what's going on. It's you're mutilating a healthy human body, and it's hard for me to see how that is in any way affirming.
Right. Yeah.
So what does the Dutch protocol involve? Well, it's basically 4 steps. The first is social transition. So you try on this new identity, and you change the way that you dress, and you groom, and you change your name and your pronouns, and you try it on for a while. And the second step is puberty suppression, as I mentioned. And then if they desire to go further, the third step is administration of cross-sex hormones. And then fourthly, plastic surgery. And so that's the Dutch protocol. And when it was developed in the late 90s, early 2000s, it was regarded as an experimental protocol. And it was used in the Netherlands with fairly strict controls around, who was allowed to go through this. And there was a lot of screening out and things like that was done. But what happened is once this was developed and some initial results were published, other countries just began to take it up and to apply this approach with much less caution, and it quickly became seen as the new standard of care, even though the outcome research really was very, very scant, if not non-existent up to that point. And now, because of this frenzy to take it up, now 20 years later, we're at a position where a lot of those same countries are backpedaling now, like England, France, some of the Scandinavian countries like Sweden and Norway. A lot of these countries are backing off of it now, and sort of hurrying to put restrictions in place, because now they see that a lot of people have actually been harmed by this.
And now they can see 20 years out what the outcomes are, because you always hear it's like, oh, this will help reduce suicide and will help mental health. And so what in general, what have they found in those countries?
Yeah. So when you do this kind of research, I mean, as you were just pointing out, Dan, you have to look long term. And no one has patience for that. I shouldn't say no one, but I mean, generally speaking, society moves quickly, right? We want answers. We want it now. We want convenience. We want it now, right? And so you have to be patient. Right? That's what it means to be a good scientist, is you have to be patient and you have to observe, and you have to be willing to observe even if what you're observing doesn't play out the way that you hoped it would, right? And we have to have a certain honesty and humility about that. So if you look at some of the short-term data, 6 months, maybe a year after somebody transitions, and you ask them, do you feel better? Are you pleased? Are you glad you went through the process? Things like this. People will often say that they're pretty satisfied, and to some degree they experience some relief in the short term, which makes sense if you think about it, because if I am distressed by the look of my body, I'm distressed by the masculine features of my body, and then I do something that changes that and makes my body look less masculine, at least in the short term, I'm going to feel better. I'm going to feel more hope. I'm going to maybe feel more comfortable in my body to a degree. Unfortunately, that doesn't seem to stick for most people. And that's where you need long-term follow-up. Because the ultimate reality is we can't erase our maleness or our femaleness. And for many people struggling with gender dysphoria, there's other stuff going on under the surface that changing the features of my body won't address in any way. And so that stuff's going to come up. It's going to come back, whether it's like you were alluding to before, trauma that I have in my past that I've never really processed or dealt with, or other types of psychological issues or wounds that I carry. Those things they're going to come up again, right? Changing the features of the body doesn't touch that stuff at all. And so regret starts to sink in, and these prior symptoms will reemerge. And the best long-term study that we have, which was a 20-year follow-up done in Sweden, showed that even after going through the whole process and living the new identity for many years, that there's still a very high rate of suicidality among people who go through this protocol. 19 times higher than the general population was the figure found in that particular Sweden study, and 3 times higher rate of psychiatric hospitalization. And so whatever is going on psychologically there, the hormones and the surgery obviously didn't resolve it.
Right. Yeah.
And now we're starting to get some data from detransitioners as well. Yeah.
And that does cause other, besides psychological issues that aren't being resolved there, there's also now new sort of medical issues, right? With the,
Yes.
like, taking these cross-sex hormones and so forth. If I'm a man, I start taking these female hormones, it's going to change physiology, and probably not for the best in terms of long-term outcomes, right? And that's going to lead to some issues. Right?
That's right. And so it actually can create more distress and new forms of distress, because now once you start down this path of medical transition, you're signing up to be a lifelong medical patient. And there are all sorts of complications and side effects that can come from these treatments. Because, just to take the example you just used, a male body is not designed or accustomed to high quantities of estrogens. And once you start doing that to the body, there can be a number of negative outcomes. And the risk, that's one of the problems with this protocol too, is you need long-term research to really document all of the risk factors, right? Yeah. We know that there are increased risks of cardiovascular problems and various types of cancers, for instance. But there may be more that we're just beginning to scratch the surface on. And then with the surgeries, especially genital surgeries, are prone to a high failure rate, and there's all sorts of complications that can happen, that can lead to some really unfortunate outcomes, involving things like incontinence and all sorts of things that are just really tragic and unnecessary. And so you add that on top of it, right? It's like now I have all this medical stuff going on, right, in addition to the unresolved psychological stuff. And that's why I feel a great deal of compassion for detransitioners, people who have gone down this path and then realized this wasn't for me, and they try to come back. And to a large extent, they're kind of abandoned by the mental health field and even the medical field to a certain degree, because they don't fit the paradigm. They're not really supposed to exist, and we don't really know what to do with you. And so they have a hard time finding support. And frankly, I think they would probably have a hard time finding support in many church environments too, just because, like, this is all new to us, and there's a certain kind of discomfort and shock that we might feel. But these are hurting souls, and they're doing something really courageous by trying to reclaim their God-given identity.
Yeah. And so many of them have been encouraged and championed to move down this route at a very vulnerable age and a vulnerable time in their lives. And now, they have, like you said, these medical issues, infertility, and so forth that are compounding that. And a lot of them were not making free choices because of all the influences that they've had around them, the psychological issues in terms of and you can see the need for good psychological care as they try to detransition.
That whole question of choice in this, and to what extent are they really freely choosing this? That's also a very hotly debated issue, because first of all, we're talking about teenagers, right? Teenagers, young adults whose frontal lobes are still developing, and even more so, we're talking about emotionally troubled teenagers and young adults. Right. To what extent do they really understand what they're saying yes to, and can make a free and informed choice? Especially if they don't even have the opportunity to really get to the bottom of their distress, right? So a lot of us who advocate for a psychotherapeutic approach, one of the arguments in favor of that is it takes time and patience to get to the bottom of someone's gender-related distress. And you can't presume to have that figured out after, a 30-minute medical consult. Right. It might take months of therapy before someone finally has an aha moment where they realize that these feelings have something to do with something that happened in their past or some other issue that they're struggling with, and to be able to start to piece that together. Right. And so, so I'm very much in favor of a kind of a slow exploratory therapeutic approach, with these young people who are struggling with gender-related issues.
Yeah, maybe you could just give a little bit of an overview of how you would favor approaching these individuals, because I think it's a symptom of sort of over-medicalization of our society. We want a pill, we want something. We all want a quick fix, for my weight loss, for my sexual issues, or whatever I'm struggling with. I want a quick medical fix, and that's not going to work if there's underlying psychological issues there. So what is there data on that we have on having a more psychological approach where we're giving counseling and accompanying them, not through transitioning, but accompanying them as they go through adolescence to discover and become comfortable in their body?
Yeah. So it's a great question. And I want to contextualize my response in terms of thinking about kind of a more general approach to psychotherapy. We've really shifted in the last 20 years or so to a very much a symptom-oriented, kind of mentality in our field and in society, right? If I have this symptom, I go get this treatment to resolve that symptom, and I go on my merry way. And that is, I think, a kind of a reductionist or a more limited view of psychotherapy. It really diverges from the richness of what psychotherapy can be and what it had been for most of the decades of the 20th century. An older and I would say more depth-oriented view sees the symptoms that the patient comes in with as simply that. They're symptoms. They're signs of some type of underlying wound or conflict that the patient himself may not be even aware of yet. And so we begin with what they're currently experiencing, but we try to walk them down a process or create a process with them where they can begin to explore and peel back the layers and to understand the roots of their distress. And with gender dysphoria, what's happening in our field is that a minority, but a growing minority of therapists are saying that's what we need to do. We need to go back to our roots, to doing more depth-oriented exploratory therapy with these young people, because they're coming in with a very complex, sort of set of symptoms. And if we just start throwing stuff at the symptoms, we really could do these young people a terrible disservice. And so what it looks like is simply creating a space where we're not trying to push an agenda. We're not trying to convince them that they're wrong about their gender identity. We're not trying to change anybody in any kind of heavy-handed way. We're simply inviting them to work with us to explore what's going on inside. And where might this be coming from? When does it come up? What seems to make it better? What seems to make it worse? What are your thoughts, your fantasies about this? When did this idea first show up in your life? And so forth and so on. And see if we can start to get down to the roots of the issue. And as we get clarity about those underlying things, we might go off and do some more focused work on that. Oh, okay, this has something to do with this, this father wound or this thing that happened over here or this abuse experience you had. Well, let's do some standard treatment stuff on that and see where that gets us. And a lot of times, what we find is that the more we get down to those deeper layers and we do that work, the symptoms just start to remit, right? They just start to kind of get less and less and fade into the background. And that's how psychotherapy, I think, works when it's at its best. And that's all we're trying to do with these young people. It's nothing particularly new or fancy or off the beaten path. It's nothing, it's not any kind of quack treatment. We're just talking about good old, plain old fashioned exploratory psychotherapy.
Yeah. Are you hopeful that this is where we're heading in the U.S., given what Europe has seen and starting to back off this sort of the Dutch protocol, that standard model of care? And is there starting to become more clinical psychologists that say, you know what, we need to wait. We need to do these more traditional exploratory things rather than jump to this treatment we know has these side effects, right? At this point, are you hopeful that we're going? Things are starting to turn?
So one thing you need to know about me is I'm definitely a glass is half empty kind of person. Sometimes I think the glass doesn't even deserve the little bit of water that it's got in it. So, so I tend to be a fairly cynical kind of, skeptical kind of person. But I will say I feel a little bit more hopeful now. Things in Europe are improving, right? And several countries, as I said, are restricting the Dutch protocol and saying that psychotherapy does need to be the first line approach, and we need much more extensive psychological evaluation before someone's considered for one of these medical treatments. And so that's good. I see that happening in Europe. Now, the U.S. is definitely lagging far behind. We're not there yet. Our regulatory bodies, our professional organizations are still very much in favor of the Dutch protocol. And I think it's still going to take us some time to catch up. I think that a couple of things are helping us move in the right direction, though. One is the testimonies of detransitioners. We're having more brave young people starting to speak out, to tell their stories of how they were struggling with this, that, or the other thing. They thought it was gender dysphoria, and then very quickly they were put on hormones, and then 5 years later or 10 years later, whatever, they realized it was a horrible mistake. At that point, their body is permanently masculinized or feminized, and they're dealing with the aftermath of that. And these stories are so compelling. They're so compelling. I mean, there's nothing quite like a person's testimony to tell you of this is how I was harmed. Right. So that speaks volumes, and we're getting more of those testimonies out there. You can find them online. Chloe Cole is one who just has a really powerful story, who's been quite vocal, very brave, speaking out. She's come here to Ohio and actually was involved in a movement that helped us, pass a law restricting these treatments in Ohio. So people like Chloe and other detransitioners, I think, are helping us kind of shift the cultural momentum a little bit. The other thing, and this is I think it's kind of sad, but it's also kind of very American, is lawsuits.
Right. No, that's certainly people. Money speaks.
Lawsuits.
Right?
Yeah, exactly. And in many of these other countries, we're talking about places that have centralized, healthcare.
Okay.
Right. So, government fiat, everything can change very quickly in terms of how medicine is practiced and how psychological care is practiced. The U.S. doesn't work that way. Right. And so here, it's lawsuits make a big difference. So there have been, and I think we're going to see more of these lawsuits where detransitioners or their families are suing doctors or hospitals or other sorts of professional bodies for their role in kind of fast tracking their child to transition when that really wasn't in their best interest. And now they have all this regret and harm that's been done to them. And so those lawsuits, I think, are going to pile up, and that's going to speak volumes and force regulators to start dialing this back. But I do think it's still probably going to take us some time. I don't know, maybe 5-10 years. I don't know. Yeah. I hope it's faster than that.
Right, definitely. Yeah, you've talked about it back at the beginning. We were talking about Rural Woods and your psychological services that you provide, and how you've this focus on sort of Catholic anthropology, what it means to be,
Right.
human, but also what it means to be male and female from a Catholic perspective. And how does that? A lot of people have this notion that the Catholic view of sex and sexual differences is overly restrictive and so forth. How do you see that as helping a Catholic understanding of sexual differences as a positive thing, a way for to achieve human flourishing, psychologically and otherwise?
Yeah. Well, so a couple thoughts about that. One is first and foremost, I think that a lot of people can resonate with, and I think there's even maybe a certain sort of relief that comes from our just appreciation of our bodiliness, just to recognize that the body is important. And in our field, in psychology, I think there's been not enough emphasis on this, not enough emphasis on, my relationship with my body and the role of my body and my mental health. But from a Catholic anthropology, a Catholic standpoint, we see the body as integral to who I am.
Right.
It's I can't separate my body from me. It's an integral part of who I am as a human person, and so how I feel about my body, how I care for my body, any conflicts I have with my body, like these are really important things for us to look at and to work through. And I think people often sort of like it's validating. It's validating for them that we take the body seriously. That's what I'm trying to say. It's validating that we take the body seriously. And then you add in the piece about my maleness or my femaleness. Okay, so from a Catholic standpoint, the body reveals that I'm a man or that I'm a woman, and that discloses something very important about my identity and my vocation. So who I am most fundamentally as a son or a daughter of God, and who I am called to become, right? Who I am called to be. And the fulfillment of my sonship is ultimately through self-gift to become father, and similarly for a daughter through self-gift to become mother. But there are many ways to live that out, right? Biologically it's the most obvious sort of paradigmatic way, but there are many ways to live that out, many ways to be father, many ways to be mother. And one of the beauties of this too is it frees us up a little bit from some of the cultural baggage that gets attached to this is what a woman is and this is what a man is, right? Now, not all of that cultural stuff is bad or wrong necessarily, but for some people who are somewhat atypical by temperament or by interests, right? They have a harder time fitting into, the cultural stereotype of what a woman is or the cultural stereotype of what a man is. And we can say that's okay.
Yeah.
It's okay. You don't have to be a girly girl, and like makeup and dresses to be a woman. And you don't have to be a big burly guy who likes sports and hunting to be a man, right? But it's your capacity for fatherhood, your capacity to be for motherhood. That's what really makes you a man or a woman. And there are many ways to live that out. And we can explore that and explore what makes that difficult for you. Oftentimes it's it goes back to the person's experiences of how the sexes were modeled for them and the meanings that became attached to them, what it means to be a man, what it means to be a woman, what it means to be a father or mother, and helping them to see a different way, right? To see these things in a new light. In fact, there was we don't have many studies on detransitioners, but there are a few, and one of them that I'm thinking of, a fairly recent study from the last about 2 years or so. One of the interesting findings was, if you ask the detransitioners, why did you decide to detransition? One of the top reasons, it wasn't the top, but one of the top reasons had to do with their understanding of male or female changed. Their understanding of male or female changed so that now they could identify with it. So the way I take that is beforehand, they had a very narrow understanding If this is my vision of what a man is, and I don't fit in that box,
Right. Yeah.
then I must be something else, right? But if my understanding of what it means to be a man goes like this, such that I can now locate myself in that space, that, oh, I can still be a man, even though I'm not like these other men, but I'm still in that group. I'm still in that's my club, right? Now everything changes. I don't need to transition anymore. I don't need to find some other identity, right? I can accept myself as a man. I might be a little atypical as a man, but I'm still a man.
Right.
Right.
Yeah, there seems to be in that Catholic perspective this sort of middle ground. So where it's not you have the maleness is not this restricted role that it has to be this.
Right.
But no, yeah, there is. You have to live out your masculinity or your femininity.
Yeah.
That is a given to achieve what God has in store for you. But it's a much bigger, broader masculinity, and not like you said,
Absolutely.
we mentioned earlier about pornography and how that can really warp your idea of masculinity and femininity, and you can see how that sort of overly restricts what it means to be a man and it means to be a woman there for people. Do you find like is there studies on looking at these individuals in terms of just their idea of purpose and meaning, like how they lose that or are having struggling with that when they're trying to divorce themselves from their body or struggling with that? Does that often go hand in hand with these individuals? Or
Yeah, I think it does. I don't have any quantitative data on that exactly, but it's a central issue for young people in general, is looking for some kind of purpose in life. Right. And I think this is one of the ways in which transgender ideology is particularly insidious, because it sort of plays on these sort of the things that naturally attract a young person. Right. We're all looking for happiness. We're all looking for meaning, and they're essentially presented with a kind of a gospel that says, if you embrace this identity, you can have a happy life, you can have this new identity, you have this new community, and you have a cause, you have a banner. We have parades now, right? You can join the cause, right? Like, so it's very psychologically powerful, because we need meaning and we need community, we need all these things. Right. And it's really hard to walk away from that. Once you start into that, it's really hard to walk away from it. I mean, just imagine too, if you were to take on a new identity and proclaim this to your peer group, and people were everyone for the most part accepts this new identity, but then later you decided you were wrong and you wanted to change back. Just socially, imagine how difficult that is.
Right. Yeah.
Right. I can't imagine what some of these young people go through. And so anyway, I can sympathize kind of on both sides with it, with the attractiveness of what's being offered to them, but also how hard it is to walk away from it.
Yeah, definitely. Now, I mean, you mentioned early on about the influence John Paul II has had on you and your formation. So maybe as we end here, and give you one last question about how the wisdom of John Paul II, how that would help in sort of understanding the nature of man and woman. How would you sort of sum that up to someone, and that might help their way to look at what it means to be a man and woman based on what he's written and what he's said, that could sort of speak into this question? Yeah,
I don't, honestly, Dan, I don't know where I would be. I don't know who I would be if it wasn't for John Paul II. He influenced my life in so many ways. And I wasn't even aware of it in the beginning, because it was indirect. It was through the teachers and the priests who were influencing me as a young adult and as a teen, and forming me. And so I'm so grateful for what he's given us, because he's given us this beautiful vision of the human person. And what I would want to say is simply that first of all, that God has a plan for you. That he has a plan for you. He has a plan that involves every aspect of you, that there's nothing that is sort of outside of his plan of wisdom and love for you. And that even includes your body and your maleness or your femaleness. And there can be many reasons why, we feel uncomfortable about our bodies and comfortable about our sex. And that's part of our human experience of growing up and living in a fallen world. All right, we all have, we all suffer, and we all have wounds and crosses that we have to bear. But God doesn't abandon us. He works through those things, and he opens a path to healing and to redemption for us. And that, again, includes even the body and our sexuality. And the vision that John Paul II gives us of the body and sex is a vision of love. It's about our capacity and our call to love and to communion. And God made us this way because he desires those things for us. He desires us to experience love and to be able to be in communion with each other and ultimately with him. That doesn't mean that it's always easy or straightforward, but that's ultimately what it's all about. And if that's his plan for us, we can trust him. We can trust him because he wants what's best for us. He wants us to be able to experience love and to experience freedom, and to, through that freedom and that love, experience communion. And so that's the ultimate message. That's kind of the big backdrop sort of vision that I always have in the back of my mind that may not always come out because, I have to be respectful of where the patient's at. But that's all what I'm always, is operating back there and guiding me as I work with the people who come to us.
That's great. Yeah, John Paul II has had a big influence on my life as well. So I love to talk about him and his writings and what his view of the human person and what it means to really flourish and how we're made for love and how we're irrepeatable and so forth. And his example of suffering throughout his life and going through
absolutely.
it is a wonderful example for all of us. So, Andrew, thank you so much for joining us today and speaking on this topic. We really appreciate your time.
Yeah, my pleasure, Dan. It's great to be with you, and really happy for all the great work you're doing as well. So thanks for having me.
All right, thanks. And listeners, if you're interested in this topic, the nature of men and women, we've been talking about it. There's a few other episodes this season on Purposeful Lab where we've been discussing this. So hopefully we'll see you again on another episode of Purposeful Lab.